My name is Morris Kariuki Chege. I come from Kiambu, Kenya, and I'll be presenting to you the work we do as a community-led organization. I myself am an individual with a lived experience. I've used substances for 6 years, and I've been able to go through the medically assisted therapy program. And fortunately, I have weaned off from medication and I've been free for a while. So we'll be presenting Enhancing Harm Reduction and Reintegration, a community-led safe space for people who use and inject drugs within Kiambu. I'll give you a context of where I come from. I come from Kenya and a county called Kiambu that ranks fourth in Kenya for the number of people who use drugs and inject drugs, with an estimate of 3,312 heroin users that were identified by a local organization. And up until 2019, there were no opioid agonist therapy treatment in Kiambu County. And through partnership with Doctors Without Borders, a MAT facility, a medically assisted therapy facility, was brought to Kiambu. And with that, we are able to have 835 individuals access MAT services as well as harm reduction services. The model of care is we are a safe space where people who use drugs can access treatment, counseling, and capacity building on their journey to recovery. Where a society of people who use drugs and their families have access to harm reduction services and support in order to live fruitful and fulfilling lives. So we operate a community-led safe space for MAT patients at the Methadone Clinic in Kiambu, complementing existing clinical services by offering clean needles and syringes, condoms and lubricants, psychosocial support, and paralegal assistance. For the safe space, we also provide referrals to HIV and TB as well as hepatitis screening. Overdose prevention guidance, which include distribution of naloxone where possible. Currently, naloxone is under strict control and can only be provided by healthcare providers, and our peers have no access to naloxone to offer directly to our community on the ground. So that is a point of policy and advocacy that we are still working on. In terms of our effectiveness, on average, 644 individuals, which include 621 men and 23 women, visit the clinic monthly. They are able to receive clean needles, syringes, where we also distribute 144 condoms on a monthly basis, but that figures varies depending with the use. We also provide the psychosocial support for our community, where 25 participants get the support on a weekly basis. We offer legal aid support, where 44 individuals get the assistance on a monthly basis. We also do community engagement as well as monthly cleanups and participation in public barazas, where we do our awareness in addiction as well as the work we do at the community level. We also do have peer educators that are trained in the harm reduction package as well as overdose response training, where they offer support to both patients as well as their families. We, as well as as a community-based organization, also do quality of service survey, where we measure the quality of service that is provided within the MAT clinics and whether it aligns with the community's needs, so that we can be able to give feedback to the caregivers and they can tailor the services according to the needs of our community. These are some of the images of the different activities that we do in our CBO, and some of these activities are, as much as we provide the harm reduction package, we also saw that our community have a problem with social reintegration. There was a question that was asked by our community. Yes, we receive the OAT services. Yes, we come for the harm reduction package. But afterwards, what are plans after the medication? Because as a result of those questions, there has been identified that a lot of individuals who are defaulting treatment, and especially during this funding cut period. So we are also trying to tailor a program where we have social reintegration as part of the harm reduction package. These are images of different trainings that we've been, and community engagement that includes cleanups and celebration of World Health Days. Those are members from my community and my team, people that we've been working with to enhance the harm reduction package within our county. In conclusion, while the SES phase is vital for reintegration, its services are limited to MAT beneficiaries, with no recent outreach activities of patients inducted externally within the MAT clinic. Expanding our outreach activities and care linkage, along with stronger local partnerships, is essential to improving harm reduction and long-term health outcomes within our country. In order to find our profile and our details, we have our contacts here. You can take a snapshot and follow us on the different platforms, on TikTok, on Instagram, and on you can email us with our email. Thank you. This is my first time coming to Inshu. I feel blessed and I feel scared. I know my throat is a bit dry. I know the room is not full, but I appreciate the energy and the learning and the knowledge that I'm getting from the community. Thank you so much for being here.